So welcome, thank you very much for joining us. We really appreciate your time. And Kyra, if you'd just like to do the acknowledgement, if you can unmute.
Hi everyone. So I'd just like to begin by acknowledging the traditional owners of the land on which we meet today, the Whadjuk people of the Noongar Nation, and pay my respects to elders past, present and emerging.
Thank you so much. Okay, so just a quick rundown of what we're going to cover today. So I'm just going to do a very quick introduction to IAPMD, a bit of a chat about finding a doctor in Australia and how to recommend one, online support groups, Australian specific support groups. We've got a video support group coming soon, we'll tell you about that. And then we're going to, Kyra is going to talk about her involvement in the IAPMD PMDD roundtable, which took place back in July. And then we're going to throw it open to a panel discussion talking all about life in Australia with PMDs. Okay, I thought this would be really interesting to share, and it's probably not really news to many of you. Just some information from the global survey that we did back in 2018, where there was over 3,000 people took part and 1,425 had been diagnosed correctly. So that means they were screened in the proper manner that can be used for scientific research. So on average around the world, people saw a 6.15 providers before reading an accurate diagnosis of PMDD, and the average wait was 12 years. And Australia actually, so you saw more doctors on average, but your diagnosis time was 10.68, so it was slightly below the average, still obviously an absolutely appalling figure and something we're working to rectify. So a bit about IAPMD, if you're new to us. We're an international nonprofit. We started back in 2013. We went international back in 2018. Before that, it was America-based. Now we are international. We have volunteers all over the world. I'm obviously based in the UK, if you can hear by my accent. So it's morning for me, good evening, good afternoon, wherever you may be. These are our social media handles. Please do give us a follow, interact, show our social media team some love. There we go. So one thing we are going to talk about is the professional community later on, about something we started where you can recommend, where if you find a good doctor who wants to do training and learn more about PMDD or PME, you can suggest they join the community. We'll talk about that a bit further. So first of all, really important, just something on our website, just so you know about it, finding a doctor. We all know this is a challenge, unfortunately. On our website, if you go under For Patients and go to Find a Doctor, you will find our international. So you can use the search function to filter doctors by speciality. And then over here is what would be recommend a doctor. There you go. So this is the place to head if you're looking for a provider of any kind. One thing that's really important, and we really do encourage you to do, we know we see a lot in the groups, people talking about doctors, ones that have been helpful, ones that have been not so helpful. In either of those cases, please go along, have a look at the provider directory. If you've seen someone good, please do just take a few minutes to add them to the directory. You can see here what information we require. We've just expanded it. It used to be a lot more limited information, and now we are asking for a lot more information. Please add a review. Take a look at the map. If your doctor you have seen is on there already, fantastic. Please resubmit them, because where we've added these extra information and requirements, lots of them are lacking, and please leave them a review so other people know what to expect. We all know it's so nerve-wracking going to see a new doctor. You're not going to know if they've heard of PMDD, let alone know how to treat it. So it really can give other people an idea of what to expect, which is so important. So as I was saying, we have now launched our professional community. So that's monthly webinars, networking discussions, and opportunities for collaborative working. So this is professionals who work in clinical practice and those who work in clinical science. So We really do want to start pushing forward and accelerating progress around education for professionals, as we all know, I'm sure we'll discuss later on, is lacking worldwide. So if your doctor is keen to learn and wants to network, then please do send them this link, encourage them to join, become a member, and they can come to the monthly webinars to learn and expand their knowledge. Just a little talk through, some of you hopefully know that we offer peer support. So we offer free one-to-one support via peer support link. There's also a number of Facebook groups. We run a non-social media support group, Inspire, if you prefer to be anonymous. We also run video support groups, and Kyra, who you'll be hearing from later on, is actually going to be running an Australian one soon. So that's really exciting, and it's in the Australian time zone. Okay, and I'm just going to pass over to Kyra, who's going to talk about the PMDD Community Coalition, which is something that took place, well, something we put together in January. It all started. We started recruiting for a patient insight panel. And the roundtable also brought together in July experts from around the world, experts and patients, putting them both at the same table, having a conversation about what needs to be done in the world of PMDD research to improve outcomes for patients. What are the outcomes that patients want? You can watch this whole video of the patient insight presentation over here on YouTube. So I'll just pass over to you quickly, Kyra.
Hi, so I'll just talk about, pretty much sum up the video and talk about the findings. So some main findings included a large time between onset of symptoms and PMDD diagnosis, often with misdiagnosis in between. So being prescribed medication that would make PMDD symptoms worse. They also found that the main level of support for PMDD sufferers came from romantic partners who took on a caregiver role. There was a lack of support and understanding from friends and family, and therefore online support groups and peer support were seen as invaluable. We found that although some members of the PIP had positive experience with healthcare professionals during their care and treatment of their PMDD, most had negative experiences. Examples included medical gaslighting, where patients were not being taken seriously, their symptoms were not being believed, or they were being dismissed by their care provider. There were many instances where the primary care provider didn't know what PMDD was. In one instance, Googling PMDD right in front of the patient. And there were also many instances of being bounced around between gynecologists, psychologists, or psychiatrists, all claiming that PMDD was not their area of expertise. So a few suggestions as patients were learning what you can about PMDD, visit IAPMD.org and check out their resources, particularly on seeing a health professional and taking the printouts with you to your appointments, which will tell your doctor a little bit about PMDD. Tracking your cycle for 2 to 3 months at least before your appointment. Looking at and adding to the IAPMD provider directory when you do find a helpful or knowledgeable health professional on PMDD to help others. But of course, it shouldn't be up to the patient to educate others and advocate for themselves, especially when they're struggling. So some suggestions from the PIP were that there needs to be increased PMDD screening, such as GPs asking if symptoms get worse around the patient's period, and questions around PMDD on things like existing depression screening tools. There also needs to be implementation of multidisciplinary care teams to manage PMDD from multiple specialisations, more research on treatment options for PMDD, increased provider education, especially at the primary care level, so that they can refer on to PMDD specialists. And there also needs to be inclusion of PMDD in the menstrual health education curriculum in schools. And last one, as this was an international panel, there should be improved insurance coverage. So in Australia, that would be Medicare and private health insurance for PMDD treatments. But of course, this was a large issue in America as well with their healthcare system. So that was some of the main findings that we found through the PIP. So that's the patient insight panel. So I worked on that throughout the year with Laura. We submitted surveys, had focus groups, shared our stories and worked together with the research team They developed a paper as well as shared their findings at the first ever IAPMD roundtable back in July.
Thank you so much. You explained that wonderfully. Yeah, and if anyone wants to find out more about the Patient Insight Panel, we will be doing a second recruitment round soon where you can feed into IAPMD services, review our website, pass on information and help us improve the way we do things. I think if Laura could pop the link in the chat, that would be amazing. Thank you. And I do urge you to take the time to go and watch this video of our wonderful patient representatives speaking at the roundtable back in July. There you go. And sorry, the boring stuff, just before we move on to the panel. All content and discussions from the following panel is for informational purposes only. It's not intended to be a substitute for professional medical advice and should not be relied on. The information shared is from personal experience. So please do your research and make your own journey. There we go. If the panel wants to pop on their videos and come and say hello. I'm not sure if I introduced myself properly. I'm really sorry. So my name is Laura Murphy. I'm from IAPMD. Obviously, I'm the Director of Education and Awareness. I lived with PMDD for many years myself. And I now get to have the wonderful job of working with this organisation to improve education and awareness around the world. So let's do some quick introductions. Kyra, did you want to go again?
Yeah, sure. So I think you need to allow my video, but I will chat away.
Apologies. Yep, I shall do that now.
So thanks everyone for coming. I hope you find the session useful and can pop over to the social afterwards on QMS Space. So I first heard about PMDD from an Instagram post actually that a friend shared with me. And so I started Googling PMDD. I found the IAPMD website, looked through their resources, and I started tracking my cycle, as this is one of the indicators that can help get you diagnosed. So in January 2019, I got diagnosed by a GP. I tracked my cycle for months and I was aware of the cyclical nature of my symptoms by now. So I found a women's health GP who specialised in mental health. She knew what PMDD was, luckily. We went through the list of criteria and she said, yes, I think you have it. So the initial diagnosis was the easy part for me. But this actually began a couple of years of trying numerous SSRIs and oral contraceptives to find a combination that worked for me. So now 2 years later from being diagnosed by the GP, I've seen a psychiatrist and got officially diagnosed with PMDD, anxiety and ADHD back in May. It's taken a long time and many trials and medications to find a treatment that works for me. And I'm sure we can all resonate with parts of this, as it's not an uncommon story with PMDD. We just don't have proper management of treatment plans. And unfortunately, there's no cure so far for PMDD. So awareness is a really big issue here in Australia, especially. And I had to advocate for myself for a large part of my treatment journey, as I saw numerous GPs due to moving around. So I ended up seeing about 10. So yeah, that is my story. I'm doing well now. I've been doing well for quite a few months sustainably. And I'm just glad to be here that I can help anyone else on their journey as well. Thanks.
Thank you so much, Kyra. And apologies, everyone. I'm having problems with the videos, but bear with me. Hopefully you can all hear us anyway. And we'll try and get you to be able to see everyone's faces. Okay, over to Kendal.
Hi. Hello. Can everybody hear me? Yes. I'm going to say yes. Okay, great. Thanks to everyone who's saying it. I can see your beautiful face, Kyra, but I still can't start my video, Laura. Hello.
That's okay. You should have rights in a moment. Bear with me. I'm just adding you as co-host and you should be able to do it then, hopefully.
That's okay. Look, to be honest, seeing my face might just be a little bit distracting anyway. But
no, you look lovely.
It's fine. It's fine. All right. So just whilst you're figuring that out, I'll sort of summarize me and my story. So my name's Kendal. I was diagnosed officially, I would say, about 18 months ago. My story was slightly different in how I arrived at the decision to essentially realizing that I have PMDD. I coincidentally was on Yasmin for a period of about 10 years. I'd been seeing the same doctor for about 8 years. He's wonderful. I actually have him on the list of doctors, recommended doctors on the IAPMD website. So if anyone wants to go and see him, it's in Perth. He's wonderful. So yeah, I'd been going to him for about 8 years. I was on Yaz ever since I was sort of sexually active, and he suggested to me way back when, he's like, look, Kendal, you know, you're spending so much money on oral contraceptives, like, have you considered just going on one that's on the PBS? And so I switched to a different to a different oral contraceptive. And then in that time frame, I got really depressed. I lost interest in having any sex with my partner at the time. But I was under a lot of stress. I was studying nursing full time. Sorry if anybody can hear this scratching. My cat is deciding that now is the perfect time that she wants to just let everybody know that she's here, and that she just wants to, yeah, hey kitty, yeah, exactly. So yeah, anyways, I was on Yaz, on this different contraception, feeling depressed, not interested in sex, went off it. All of my desire for sex came back. I was instantly happy. I decided to get an IUD put in, but I didn't want to have anything to do with hormones because I'd sort of had this bad response, due to low sex drive and also feeling depressed. So I got the coil in without any hormones. So my body was running on its natural cycle. And I still can't use my video so you can see my face, it's just FYI. So it doesn't really matter. So I was cycling and I was getting like ferociously mad at my partner at the time. And one time I did this Instagram post and I'd said, does anybody else feel like right before they get their period that they want to smash heads up against a brick wall and gain pleasure from the thought of heads exploding? And a lot of people said no. So I realized that my very violent thoughts that I was having and how I was feeling internally was not necessarily as common as I would have thought it would have been. So I went to my doctor, and because I'd always been interested in just tracking my cycle, I was tracking my cycle, and I'd heard of a friend of my partner's who, she'd had PMDD, but she experienced very, very severe PMDD. I think in her case, perhaps it's more premenstrual exacerbation, so PME. If you're not familiar with that, just write it down. I won't explain it, but essentially, if you have, a pre-existing medical condition, essentially it just exacerbates it. So she would experience sort of psychotic episodes in that time frame. Now, because I don't experience that or didn't experience that, I thought, surely it can't be, PMDD. But fairly consistently, I was experiencing it, tracking my cycle, did that for about 4 months, then went to my doctor and I said, look, I can quite literally pinpoint exactly when I start feeling this way. On days 23 to 27, I was fairly consistently having thoughts of suicide. I recently realized, because I'm still tracking my cycle, that on day 21 and 22 of my cycle, I'm in a same-sex relationship, that my partner and I would almost, literally every time in the last 4 months, we would pretty much break up because we would just have really severe fights. And so yeah, long story short, that's how I ended up realizing that I do have PMDD. So we went down the pathway of essentially trialing treatments. The very first treatment sort of that he recommended to me was chasteberry, which didn't work. I don't know if anyone's familiar with that. None of that worked. We went down the route of SSRIs, so fluoxetine. Initially it was continuous, then I went to luteal. I didn't necessarily like it, worked for me, but I didn't necessarily like some of the side effects, one of which was sort of a bit of a loss of interest in sex. But now I take calcium, which is actually evidence-based. It's just old research, and TRESS-OSB, and I rely quite heavily a lot on coping mechanisms, which is primarily focused on exercise, eating well, yoga, mindfulness, and everyday tracking my cycle, and just good communication between myself and my partner. So they're the things that I found over the course of my own personal experiences has worked really well for me. And yeah, I think that's all I can really say about that.
Thank you so much. And hopefully you should be able to turn your camera on now.
Hello.
There we go. Yay. So sorry. It was in the settings and it looks like the only one that's not going to be able to do it is me.
That's okay.
So,
that's fine.
Sharon, you should get a notification as well in just a second. So over to Fiona.
Hi there. Sorry, just like Kendal, not a cat, but my dog is insisting on playing with his squeaky toy right
That's
about
always
now.
welcome.
So my story's a little bit different to most. I just turned 40 and I today am celebrating my daughter's 10th birthday. After her birth, I had a very problematic pregnancy. I had 4 miscarriages before her. I had been on birth control on the pill for 10 years, from 15 to 25. As soon as I got off that, I started to experience terrible, they're called vestibular migraines, every time I had my period for like a week. This went on for years. I had all sorts of hormonal problems that I'd never really experienced before. I had 4 miscarriages. I managed to fall pregnant with my daughter and knew she was a keeper. She was definitely a strong little one. I had a really bad pregnancy, and 6 months after I gave birth to her, I collapsed. I didn't get out of bed for another 6 months. I was sick of being told by doctors, oh, it's in your head, it's this, it's that. Turned out it was stage 4B adrenal fatigue. So I am a nutritionist, and now I specialize in hormone disorders. And basically what I like to describe as hormones are like spinning plates. So once one goes, they all go. And after the birth of her, I had severe adrenal problems. I also developed polycystic ovary syndrome, which I'd never had a problem with before. I was getting cysts the size of oranges regularly. I remember once I was flying from New York to the Caribbean and the plane had to land in Miami and I had to get an ambulance, and yeah, they found like an orange size or grapefruit size, they said, cyst had ruptured. And I started to experience symptoms then, which I had not had before. I'd never really had, you know, PMS or anything like that, a bit of bloating, a bit of food cravings, but nothing really else. It was a real challenge. I was in a new relationship. I had divorced my husband, the father of my daughter, and I was in a new relationship which turned out to be, unfortunately, quite volatile. I was very, very fortunate to have my best friend, Shay, and she had PMDD. She had been diagnosed. And after a few months of her and I sort of back and forth chatting, we kind of established a bit of a timeline. She's like, you need to do the diary, you need to, you know, track this. And for someone that had never had any, you know, hormone sort of issues before, it was very eye-opening. So yeah, I tracked my period for a few months and my mood. It was quite difficult at the time to sort of work out what was my relationship, what was me. As someone who was quite intuitive and really gut related, I would always trust my gut. That just went out the window. Like I sort of felt like sometimes I went, am I going crazy? Like, am I experiencing things that are not actually real, or am I exacerbating things? You know, unfortunately, my partner was not fabulous with that, was not very supportive. Long story short, was diagnosed with PMDD thanks to the help of my friend, who had gone through, I would say, 5 to 8+ years of inaccurate diagnoses, you know, mistaken bipolar, all sorts of stuff like that. And I even went to a psychiatrist thinking, am I bipolar? And she's like, no, you're definitely not bipolar. So look, I was really fortunate to have her, and she guided the way with that for my own diagnosis. I had such severe polycystic ovary syndrome post-birth, which is a little bit unusual. Usually you get it before you have it, you know, always it's a genetic thing. But for mine, my huge hormone meltdown was exacerbated that. I had half of each ovary removed. My new husband, second one, really wanted kids. And so did I. I wanted more children. So we removed half of each ovary because they were so stimulatory. Unfortunately / fortunately, now I look back from that, both of them adhered to my size. One adhered to, you know, linings, things like that, my bowel. So I had a huge amount of adhesions and scarring. And we went forward with the process. It was deemed that I wasn't physically able to fall pregnant naturally. My new husband was very, very keen on having more kids, and I thought I did too. Trying to find someone that actually not only knew anything about PMDD. I don't know about anyone else, but is there anything more disconcerting than going to a doctor, a health professional, and going, so I've got PMDD, and they go, oh, what's that? Sorry, what? And they go, oh, did you self-diagnose? And then you see them Googling something. You're like, come on, mate. I know more about this than you do. It was quite disconcerting. Long story short, had to have numerous surgeries, was not deemed able to provide children. And I didn't doctor shop, but the surgeon that removed half of each ovary, I just was not happy with. It was quite gung-ho. Found a fabulous OBGYN in Melbourne, and he was brilliant, Dr. Joseph Scroy. And he listened to me basically for about 18 months to 2 years on a regular basis, calling his reception office just in tears, just going, you have to help me. I can't live my life like this. Even though I had not had it for a very long time, as I said, it was postnatal, which a lot of cases can. It was quite severe. I had a severe progesterone intolerance, which I know a lot of PMDD sufferers do. But we also sort of recognize that it wasn't just the progesterone. Anytime you get put on any kind of hormone help, there is that fluctuation or any kind of hormone change. And that is what PMDD responds to. Whether you are progesterone intolerant or not, you have that initial hormone response. So it can take, you know, a week or two. They go on the pill. I went to 7 or 8 doctors and they all said, go on the pill. And I went, you can shove your pill because it's not going to help me or fix me. Anyway, so I had my fantastic OBGYN, Dr. Scroy, who really, really listened to me. I had to jump through the hoops per se, which I totally get. They're not going to give a 35-year-old woman a hysterectomy off the back of nothing. But I knew, because of my first pregnancy, how problematic that was. I had severe hyperemesis gravidarum. I had a whole lot of other problems. I was bedridden for such a long time. And then with my adrenal fatigue as well, as I said, hormones are spinning plates, so they're all related. Everything just went haywire. Even after cutting my ovaries in half, I still had PCOS, was still struggling with a lot of cysts. So there was a lot going on. I had scarring, I had adenomyosis, I had a little bit of endometriosis as well. So we used to call it the alphabet soup. And I think we sort of got to the stage where I would say to Dr. Scroy, listen, I'm done. I can't do any more. My husband at the time wanted more kids. I obliged and went through a couple of rounds of IVF for a surrogate. It's a whole other story. And yeah, I got my hysterectomy when I was 35. And it saved my life. It's not something that I like to promote to everyone, because I don't think it's not a quick fix. It's not an easy sort of thing. I have been so lucky, because my best friend also had a hysterectomy 6 months prior. She has not been as lucky as I have in terms of finding the hormone dose and finding, you know, a whole lot of other stuff. But I had to go through the chemical menopause. We did all of that. And it's very disconcerting going through all of that for 6 months. You're injecting yourself monthly. As well, you're trying on a whole lot of hormone replacement therapy, HRTs. And every time you try something new, you get that fluctuation, which we all know PMDD sufferers, any kind of hormone fluctuation is hell, basically. So I remember going through IVF, and I am severely progesterone intolerant, like some, but not all PMDD sufferers. And I remember driving my car along the Westgate Bridge and just wanting to drive off it. And I hope this is not a trigger for anyone. But my hormone reaction was so strong, and I just went, this is not right. And the fact that GPs were still going, go on the pill, I would just go, you don't know anything. And I would go and going, I know more about this than you do, rah, rah, rah. Again, disconcerting. I was very fortunate. I had my hysterectomy. They don't give hysterectomies, from my understanding, for purely PMDD. When I say I was fortunate enough to have half of each ovary removed, bad scar tissue, PCOS, I had my adenomyosis, I had endo, I had basically alphabet soup. So I had my hysto, and I remember waking up from my hysterectomy, and they did a radical hysterectomy, so ovaries as well. And I just went, and a lot of people say, oh, it's just post anesthesia euphoria, but I just went, oh my God, I can breathe. And yeah, I made a really concerted effort. I think professionally doing what I do as a nutritionist, a lot of my specialty has sort of fallen back on hormones. And I made a really concerted effort to put everything I can into the best possible recovery. And I tried the creams, I tried the patches, I did all the things that all the doctors say for HRT, and the tablets and the, you know, pessaries, everything. And I think I knew my body well enough by that stage to go, okay, this isn't working, but not to get disheartened by having a fluctuation and having those PMDD feelings again, even after a radical hysterectomy. It can be quite disconcerting going, have I done the right thing? Rah, rah, rah. So I've had to really go, nope, I'm right. And I've had arguments with mainstream GPs still. And they go, what do you want? And I say, I'm on XYZ, I'm on a Troche. And they go, well, that's not proven. And I go, I understand that, but I have done the pills, I've done the creams, I've done the pessaries, I've done everything. This is what works for me. So I think the best thing I would recommend, and I get people, I did a few articles, I did a podcast with Yumi Steins about it. So I get people internationally still messaging me going, you know, what do you recommend? What do you recommend? And the hardest thing to do is, I'm not one as a science-based sort of person to go do your own research, but you need to back yourself. So keep a diary, keep it thorough. You need to be able to clinically show that the 2 weeks from day 14 to 28 from ovulation, you're actually having those symptoms. You need something to back it up, and you need someone that will listen. I'm 40 now, so I had my surgery 5 years ago. And other than these sorts of forums or getting a message, I am so blessed and so privileged to say it is not a part of my daily life anymore. It is not something I even have to think about. I pop my hormone twice a day, and I just don't have to worry. So I know I'm one of the lucky ones. And I work with a lot of clients that come to me now that have been through that, you know, rigmarole. I had 7 years of chronic illness with misdiagnosis and just suffering of not actually being aware of what was going on. So finding someone, I think, to actually listen and understand and to take it seriously is the most imperative thing that I would recommend for anyone. Not a long story short at all. That was way too long, but yeah.
Thanks so much, Fiona. I think Laura is having problems with her Zoom, so we'll just go to Dr. Sharon Mill. Thanks so much for joining us. She is a clinical psychologist here in Australia. So do you want to tell us a little bit about yourself, Sharon?
Yes, okay. And can I get my screen? That one? Okay, can you hear me? Yeah, can you hear me? Kyra? Lovely. Yeah, so I'm Sharryn Muir, clinical psychologist in Melbourne. So I'm post-menopause now, I'm 56. However, I have lived experience of PMDD. I'll just give you a brief overview of my personal experience of it. So I was diagnosed at 37, which was after the birth of my second child. So I had PMDD since menstruation, but it really became exacerbated after the birth of my second child. It's possibly because I had a miscarriage in between my first and second child. So hormonally, I was quite disrupted after the miscarriage, had the second child, and then PMDD was very severe after that. After I sought therapy, which was very ineffective, unfortunately, I didn't know it was PMDD. We're going back sort of 20 years now. I'd never heard of it. I sought therapy thinking it was just postnatal depression. It was quite ineffective and unhelpful and somewhat, destructive actually. And then I went to a GP who I just got lucky. My regular GP was away, so I just got lucky with a GP that was there that day. Within 15 minutes, she diagnosed PMDD. And back then, she said there's 3 options: Agnes Casti, evening primrose oil, and Prozac. So I thought about it, and a week later, I went on Prozac, and then bingo. That gave me significant symptom relief. However, because I was heading for perimenopause, and as we know, perimenopause in Australia, the onset is typically 46, but we know that the brain changes in several ways 5 years before that. And the changes in the brain that occur approximately about 40 are including the allopregnanolone receptor area. So I became quite symptomatic again in my early 40s with perimenopause, which, as we see a lot with PMDD. So I was quite symptomatic again across those years. And then by chance and luck again, I read an article in the Age newspaper by Jayashree Kulkarni, the Professor of Women's Health at Monash Alfred. So thought great, and went and visited her. And a thorough assessment, which they still do at Monash Alfred in Melbourne. She, of course, confirmed PMDD, and she put me on Zoli, which is a contraceptive pill that we have in Australia. And Zoli was, again, fantastic. I responded really well. As we know, 50 to 70% of women respond well to Zoli. So that took me through to HRT, and then HRT, which I'm still on. I'll probably be on HRT for life. Again, as many women that are sensitive to progesterone, allopregnanolone, and estrogen, I'll stay on that to stabilise me. Interestingly, I went off it for a few months earlier this year because I've been stable now for quite some time. And I had a recurrence of symptoms, so I'm back on it, but that's okay. I'm happy to sort of stay on it. Yeah, so that's my history of PMDD. So of course, my special interest is because of my lived history and the fact that, of course, when I got diagnosed, there were no psychologists or clinicians that really heard of it. It was just luck for me. When I came across Jayashree Kulkarni, I also came across Dr. Rosie Worsley. So she's an endocrinologist in Melbourne. Amazing, specialises in PMDD, an absolute expert. So I've been a clinical psychologist since my early 30s, but in the last few years, I've really specialised in PMDD. So I'm exclusively PMDD treating women with that now. That's my whole caseload. I sort of take a collaborative care approach in Melbourne. So I share a lot of clients with Rosie Worsley. So she refers to me, I refer to her. So she does the she's an endocrinologist. She does the endocrinological side of it and assessment and treatment. I do the psychological side of it. I use the most effective approach that I found is an approach called DBT, dialectical behaviour therapy. So although there's no research on DBT for PMDD, because as we know, there's no research on, psychological, comprehensive psychological therapies, I find this a really good fit because two of the big areas in this approach, DBT, the skills in it are for distress tolerance and emotion regulation. So these are the skills that can be enormously helpful for dysregulation and high distress, for when women are, very depressed or raging or whatever symptom expression they're experiencing. So I also am very acutely aware of the dearth of psychologists seeing PMDD. To my knowledge, I'm the only psychologist specialising in PMDD in Australia, but I'm happy to be disproven wrong. If there's others out there, I'd love to meet them. So to sort of address that, I also developed an app over the last year, an Android and Apple app called PMDD Treatment, that I put on the market a few months ago, and that's quite a useful sort of adjunct for women out there that can't see me. My waiting list is long, although I'm trying to address that, or they just can't see anyone anywhere across the world, basically, for PMDD treatment. Yeah, that's sort of the short of it. I could talk on and on and on about PMDD, of course, but that's a pretty much an overview. Yeah.
Thank you for sharing. Hi everyone, I'm Laura TJ. I'm the social media manager for IAPMD. Laura Murphy is still with us. She is having some techie issues, so I do apologise for that. But luckily we've got this amazing panel to keep us all going anyway. Just as we start to kind of round up today's session then, what we'd love to hear from our panellists is, what do you think needs to be done to improve standards of care for people with PMDs? So if we maybe start with Kyra, if that's okay.
Yeah, so it all starts with more research and more research and more research. Research, awareness, education, there's kind of every every part needs just more research into it, which comes back to women's health, which isn't prioritised, especially when it comes to this in between of menstrual health and mental health as well, affecting women. So being here in Australia, there is a bit of research going on, but it's really funneling through from America and Europe and other countries. So it's just taking its time to funnel through, I think, especially to health professionals. So it would be great if more GPs knew about it, however, which way that is, which is very hard, I know. GPs need to know a little bit about everything. So just starting with GPs being more knowledgeable, at least if they even know what it is and they can refer on to other people. The ICD-11, their newer version came out in 2019, which has classified PMDD as a gynecological issue. So it's that's previous to the DSM-5 in 2013, which is what most Australian healthcare professionals use, which classified it under a depressive disorder. So there is getting a little bit of traction there. It would, just be great if we had more specialists like gynecologists, psychiatrists, endocrinologists putting their hand up to say that they specialise in PMDD and getting that awareness and education out there to women. And the other thing I think that is actually very underrated that I talk to a lot of other people about with mental health care conditions is that we found out we had whatever condition we had through places like TikTok, Facebook, Instagram. So as long as the information is factually correct, I think they are really great platforms to use. So I think patients are getting sort of sick of not learning about this or having those proper educators out there. So they're sort of teaching themselves and using their platform on social media to bring this awareness of conditions out there. So yeah, that's my take.
Thank you. And Sharon, if we come to you.
Yeah, so a lot of that I would concur with Kyra. Obviously, there's an incredibly important need for more research. There's no doubt about it. In addition to that, we need, I think, education in courses like medicine. We need education in psychiatry. We need education in clinical psychology. So at the moment in Australia, there's zero content on the relationship between women's reproductive hormones and their mental health in psychiatry, in medicine, in clinical psychology, which is just absolutely appalling. So people can graduate from these degrees and still not have heard of it, which is just totally unacceptable. So we need it in those areas. We also need some training for clinicians. So, I mean, what IAPMD, International Association, is great, what's going on at the moment. So clinicians can learn about it. So I sometimes go into GP clinics to do talks for the GPs about what PMDD is and so forth, just to sort of skill them up. But again, I'm one person, so I think that, and they're often very receptive. They want to learn about it, they want to hear about it, but we need this more systematic, so increased training, I think, is really important. Even if it was just I don't know, half a day or a day, at least they've heard of this and the research behind the reproductive hormones and women's mental health. Yes, and research, which we know is funding, but it's incredibly important.
Absolutely, and there's lots of comments in the chat just agreeing with everything that you both have just said. Fiona, I don't know if you've got anything to add. Your video is off at the moment. Or Kendal, if you've got anything to add there.
I was just writing notes just to add. So good news is I am actually doing some research on PMDD, which is great. So it's part of my master's. So hopefully that will make everybody happy. Just to FYI on that. But stay tuned. I will be looking for participants at the start of next year. So if anybody wants to participate in my qualitative research, then definitely let me know. But that's later down the track. In terms of standards of care, there's 2 things that I want to say. First of all is that it's really easy, and just to clarify, I am a registered nurse and I do work in sexual health, and I also work a lot in trauma and acute medicine. So I've worked in ED settings. I'm worked in those sort of like first responder settings. So I'm very familiar with the healthcare system within a tertiary hospital setting. So, and I have lots of friends that are medical professionals as well. So, the most important thing that I think helps is to have knowledge of how the female reproductive system works and knowledge of yourself and how your particular cycle works for you. There is nothing more powerful than walking into a GP with evidence that says, this is what happens to me on this particular date. Tell me I'm crazy. This is what happens. This, quote APA 6, quote ICD 11, do all of that, use all of the resources that are there on IAPMD and do all of that. But there is nothing more powerful than women and AFAB people being empowered by knowing how their body works. None of these things are going to change until, you know, we demand that that change happens. And fundamentally, just knowing yourself, that's how you're going to make a difference to yourself. Fundamentally, sorry, I've just lost track. My ADD brain has gone like blah, like in all of these like explosions of all of these things. But tracking a cycle, that's the summary point that I want to make there. That's and advocating for yourself, that is the most important thing. The only other thing that I wanted to mention in terms of how we can change the healthcare system in terms of what we can do is advocating in general for menstrual cycle awareness. So I sometimes work at a hospital in Western Australia, which is dedicated to female women's health. And I haven't actually worked in the emergency department there, but even on our patient admission form for a women's hospital, it doesn't actually even ask what day or stage of that particular woman's cycle they're on. So by not asking that question, we're essentially saying that the day of the cycle doesn't matter, when in actual fact it does. Because if you have anxiety, if you have depression, there's a bucket ton of research that says that, you know, during your luteal phase for a number of different disorders, that things essentially are exacerbated for you during that phase. So the only other thing that I really wanted to add and that I just really wanted to share with everyone was that in my personal and professional research, I discovered significant links, and a lot of the research, which is, you know, I had to sort of go down a very deep dark hole to find it, is significant links between trauma and chronic stress and the stress response, and links with allo. So personally, I realized that I had quite a lot of trauma, I had chronic stress, and a lot of that was exacerbating my symptoms. So for me personally, what I found really effective was actually working through that trauma and actually managing my stress. So since I started doing that and being more empowered and knowing what my triggers were, what I was reacting to, and actually processing and working through that trauma, I then also did subsequently start to notice a reduction in my symptoms, which is something that I would just really recommend for everyone to do. So if you have a history of depression or whatever it is, and it's, trauma isn't just a traumatic event, trauma can build up over time. So by looking deep into what your history is as a person and then essentially working through that. So if we can reduce trauma, minimize stress, and then work through it, then eventually your body will hopefully start to recalibrate, or more importantly, just get better at handling your traumas. Anyway.
You know what, you've made some really great points, and I can see lots of nodding heads and people in the chat all saying, yeah, totally agree with this. But I know that we have gone over time slightly. Fiona, just see you popped your hand up quickly there.
I can be reached on Fiona Willox, WILLOX, on Facebook, or Integrated Nutrition. You can find me on all the platforms. And just really reiterating what Kendal said there, a lot of people go to a therapist and you're like, oh, it's not that, but it's a part of it. It's a multifaceted condition. And even though you go, but it's not that, it's a little bit that, even if you don't think it is. So there is a hormone response. It is not severe PMS. It is a completely different condition. Never discredit yourself or doubt yourself, but also you really need to be committed to going, this is not a quick fix kind of scenario. Even if you can't get a hysterectomy, you need to do the work mentally, physically, dietary, in every sort of way. So it takes a lot of soul searching and a lot of guts to really acknowledge and look deep within, but they're the first steps to really finding peace. And as I said, apart from these forums and things and questions, it's not even a part of my daily life, whereas at one stage it consumed every waking moment of my life. So if anyone has any questions, feel free to message me, and I apologize for not reaching the group afterwards, but good luck on your journey.
Well, thank you just for coming on today, Fiona, and sharing your time, for all of you just for being so vulnerable, sharing your personal experiences and your professional insights as well. I know it's helped so many people.
Thanks so much. Thanks for having me.
Thanks, everybody.
Bye.
Bye. Bye.
Thanks, everyone.
Thank you.